Hello, and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician, and today I'll be discussing aging and the heart. Several changes can occur in our hearts as we age, such as heart attacks and heart failure. In this presentation, I'll give you some ideas on preventing and managing these changes. The information in this presentation is supported by high-quality medical research and expert medical opinion, and references are given at the bottom of many screens. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. Shakespeare said, "A light heart lives long," but I suggest that a healthy heart will help you live even longer. Heart disease is still the major cause of death in seniors 65 years and older. Looking at this graph of deaths per 100,000, we see that through 2006 to 2016, death from heart disease has slowly decreased, but it's still the major cause of death in seniors. Common heart diseases as we age include coronary artery disease, such that by age 60 years, that's found in 60% of men and 36% of women, and most of these people have no symptoms. Another common cause is irregular heartbeats or arrhythmias, like atrial fibrillation. Also, as we age, we're at higher risk for heart valve disease and for diseases of the heart muscle. A little refresher. The heart is basically a pump, and blood comes in from the head and the arms, from the internal organs in the legs, into the right side of the heart, where it's then pumped out into the right and left lung. It receives oxygen from the lungs, and the blood then is pumped into the left part of the heart, where it's pumped into the aorta to go to the head and arms and into the internal organs and the legs. A little anatomy refresher. If we look at the outside of the heart, we see there's the superior vena cava, which with the inferior vena cava brings blood from the body into the heart. We see the aorta and the pulmonary artery. On the outside of the heart, though, are the coronary arteries. The heart is full of blood. That's its job, to pump the blood. But the heart does not get oxygen and nourishment from the blood inside the heart. It comes from blood in the coronary arteries, the right coronary, the circumflex, and the left anterior descending artery. These feed oxygen and nutrition to the heart muscle. If we look inside the heart, once again, we see blood coming from the superior vena cava and the inferior vena cava from the body into the right atrium, where it's then pumped through valves into the right ventricle. It's then pumped again through a valve into the right and left pulmonary arteries. Once again, as it receives oxygen, the blood is returned to the heart through the pulmonary veins into the left atrium through a valve into the left ventricle, where a pulse pumps it out through another valve into the aorta and the rest of the body. As we age, our heart changes in several ways. One of the changes that can occur as our hearts age is in the heart valves. The heart valves are responsible for directing the flow of blood through the heart and through the lungs. For instance, the blood comes in from the body through this valve into the right side of the heart, through this valve to the lungs. Coming back from the lungs, the blood goes through this valve into the left side of the heart, where it's then pumped through this valve into the aorta. Thickening and stiffening of the valves can occur, and this causes a less efficient flow of blood. This can cause heart murmurs, decreased blood flow to the lungs and to the rest of the body, with the result of weakness, fatigue, heart failure, and even cognitive problems. Another change that can occur is in the electrical conduction system. Our heart beats and pumps because of the action of pacemaker cells in the upper right portion of the heart. On a regular, timed basis, these cells release an electrical spark that spreads to the rest of the heart. And it spreads into the lower part of the heart, the strong pumping part of the heart, through an electrical conduction system like a electrical wiring system. It carries the charge through the ventricles and causes the heart to contract. That's the pulse that we feel as the blood is pushed out of the heart and into the body. As we age, there's a decreasing number of pacemaker cells, and degeneration occurs also of the conduction system cells. And as a result, we can develop a slower heartbeat at rest and also with exercise. We can develop skip beats, abnormal heart rhythms like atrial fibrillation, and if the system fails completely, our heart can stop. Changes can also occur directly in the heart muscle as we age. Weakening of the left ventricular wall here and here can cause less efficient pumping. This is often due to coronary artery disease, but also can be due to high blood pressure and obesity and diabetes through the effect of diabetes causing increased coronary artery disease. This decreased pumping strength of the heart muscle causes decreased cardiac output, decreased output of blood into the rest of the body. And that's what we call heart failure. And that can result in weakness, fatigue, and cognitive problems. But the change with aging that's the most common is in the coronary arteries. This is the external heart again with the coronary arteries that feed nourishment and oxygen to the heart muscle. A normal artery is open and clear with normal blood flow and adequate oxygen gets to the heart muscle. But cholesterol and calcium deposits in the coronary arteries can block the transport of blood and oxygen through the formation of plaque. This results in heart muscle weakness and heart failure, irregular heartbeats, fatigue, and heart attacks. Let's talk about the risk factors for heart disease. We break them down into non-modifiable heart disease risk factors and modifiable heart disease risk factors. The non-modifiable ones are ones that we really don't have too much control over. Family history is one, and of course we can't choose our parents, but also a history of previous heart attacks is a risk factor that is to some extent non-modifiable. Three important modifiable heart disease risk factors are poorly treated long-standing hypertension, elevated cholesterol, and diabetes. As you can see on this graphic, each of these items has its own risk levels, but when combined with the others, the risk levels are quite a bit greater. This gentleman suffers from several other modifiable heart disease risk factors, which include chronic heavy alcohol use, smoking, obesity, lack of exercise, thyroid disease, and also chemotherapy can damage the heart. It's interesting that obesity does not just cause problems because of the excess weight, but fat cells in obese people release cytokines, which are chemicals that damage the coronary arteries and the heart muscle. How can you keep your heart healthy as you age? Well, first, no smoking. Also, keep your medical conditions under good control, working with your health professional to maintain your normal blood pressure, to treat elevated cholesterol, to keep your diabetes under good control, and also to manage your current heart disease like angina or irregular heartbeat or heart failure. Eating a healthy diet is very important for keeping your heart healthy. And research shows that the best healthy diet is the Mediterranean diet that consists of whole grains, vegetables, legumes, fruits, nuts and seeds, olive oil, fish and seafood, with dairy and poultry in moderation, and red meat and sweets only occasionally. And also, don't add salt to your food. Also important to maintain a healthy weight. Talk to your doctor or your nurse practitioner or your physician assistant for suggestions on how to maintain a healthy weight. Get 7 hours of sleep each night. Less sleep and more sleep appear to be risk factors for heart disease. And avoid stress. And the best way to avoid stress is to shut off the news. I've had a lot of patients and friends who've told me that they get so stressed out by news and it makes them feel miserable. Well, it doesn't help their general outlook or their emotions or their blood pressure. And I've told them to stop watching the news, reading the news, and they've told me how much better they feel. I'd suggest that you turn off these news sources for 2 weeks, and I think you'll feel better. And let's face it, if you watch the news, you'll find that it just upsets you, and you'll realize that you really can't do a thing about what you're reading in the news. Try this for avoiding stress. You can also keep your heart healthy by limiting your alcohol intake. For men, 2 or fewer drinks a day. For women, 1 or fewer drink per day. And 1 drink equals 12 ounces of beer or 9 ounces of malt liquor, 5 ounces of wine, which is a standard wine glass like you see in the picture, or 1.5 ounces of hard liquor. Exercise is crucial for keeping your heart healthy as we age. Exercise includes brisk walking, exercise classes, yoga, tai chi, qigong, gym workouts, and Wii exercises like bowling, but also dancing and even gardening with the bending and the lifting and the digging and the pulling. It's good exercise. Experts suggest that you aim for at least 150 minutes of aerobic exercise per week plus muscle strengthening exercises 2 days a week. That may not be realistic for people with busy schedules. Other experts suggest that walking 10,000 steps per day will decrease cardiovascular risk, and that's certainly true. But walking fewer steps per day can also be beneficial. In fact, walking 6,000 steps a day at any pace, fast or slow, decreases cardiovascular risk by 40%. Most cell phones have an app for measuring steps per day, and so do wearables like Fitbit. And I think the crucial thing is that you do the best that you can. Where can you get heart healthy? Well, I'm a big fan of senior centers, and I suggest you check at your nearby senior center for exercise programs, for healthy meals. I think you'll find that this is a good place to check. Well, let me leave you with one last wish. I wish that you be heart healthy. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.